Well, good afternoon, and thanks to everyone for joining us today, and for those that are watching from home. I hope that everybody is staying safe and healthy. I know you have one thing on your mind, and that's vaccine, so let's turn right to that. First of all, I want all of you to know that I understand your frustration. I know you're out of patience, and I am as well. Everyone across the country is tired of the pandemic. We all want to put COVID behind us and get back to normal. We know that vaccines are the way out, and everyone wants to get their shot now, and I get that. You deserve to know what's going on and what happens next. So today, we're going to talk about two major things. We'll talk first about how we are accelerating Virginia's work to get more shots in more arms faster. That has to do with supply and logistics, how we move that inventory around to get it in the right places. Then we'll talk about how Virginia is significantly expanding transparency, so you can know exactly what's going on. So let's get to it. I want to start by reminding everyone where we are as a country. The first shots became available in this country in the middle of last month. We told you then that the first shots would go to the people who are most vulnerable, healthcare workers and people living in long-term care. We estimated that to be about 500,000 people. Today, about a month later, more than 520,000 shots have been given in our Commonwealth. It's important to know that. It means that we are on track. It's also important to know that in just 1 month, more people have been vaccinated than have tested positive in the entire year of the pandemic, and that is good news. It's also important to remember how the system works. The federal government contracts with drug companies to manufacture vaccine. The feds then allocate doses to the states, and we then distribute them to hospitals, clinics, and others to give shots to people. You'll recall that we laid this plan out for you at a press conference not too long ago, and we said then that everyone should expect things to be bumpy at first. Let's talk about one reason why that is. People can get shots only if we have shots to give, and there has been a lot of uncertainty about that, especially over the past 2 weeks, and I'll give you an example. 15 days ago, the outgoing Federal Secretary of Health told states, open up eligibility to everyone 65 and over. We'll send more doses. If you don't expand eligibility, we'll reduce your supply. Then 2 days later, states learned that there were no more doses to release. That made a confusing situation even more confusing across the entire country. So it's not surprising that places that had doses held on to those doses. That led to a reality that is both too much supply in some places and not enough in others. That's true in Virginia and around the country. I'll tell you in a moment how we're dealing with this inventory management issue. But first, you need to know how this is being addressed at the national level and what our federal partners are doing to expand supply available to states literally starting tomorrow. I've spoken with the White House twice in the past week. Yesterday, I joined a call with the White House and governors of the 50 states. And what I heard was states dealing with all the same issues we're dealing with here in Virginia. Not enough supply, not enough transparency, lots of logistics, and not enough time to plan. I also heard something that I have not heard since the pandemic began, and that is a commitment at the national level to work together, find solutions, and get this moving so we can all get back to our lives. I heard a spirit of bipartisan cooperation. Big states, small states, red states, blue states, East Coast, West Coast, and the Heartland. I can't tell you how relieved I was to hear that. The White House told us two pieces of good news. First, states are going to receive about 16% more doses immediately. That starts with the orders we will place tomorrow. Second, they're locking in this increase. So instead of being forced to operate week to week, we will now be able to plan out a month. This is really good news, and it's one critical part of our plan to get more shots in more arms more quickly. But being able to do that and being able to plan a month ahead all depends on having a stable supply and trust that the supply will continue to roll in. So we turn to General Gustav Perna for answers. He is the Army four-star general who leads the federal supply effort. We asked, how can we be confident that we will receive these additional doses in the weeks ahead? He told us that after more than a month of working, the drug manufacturers have hit a stable, regular, sustainable cadence of production, and that is good news. He is confident they will deliver the doses they have committed to the nation, and that's why he and the rest of the Biden team are making the decision to allocate more doses to the states. And as we heard in the news media, this is one critical step that will allow all Americans who want a shot to get one by the end of this summer. That's our country's goal, that's Virginia's goal, and Virginia is prepared to deliver. I got off that call and met with our team. I told them, this is good news, this is our goal. And I said, people are counting on us to work harder and faster to meet it. So let me tell you where we are at the state level in Virginia and what we're doing to accelerate. Here's our progress at giving shots. We have given 594,828 shots, putting us 11th among all the states, giving more shots than 39 other states. On a population basis, we have reached about 7,000 per 100,000 people. That puts us 26 among the states and the District of Columbia. This puts us right in line with our neighbors like Maryland, North Carolina, and Tennessee. You'll recall that 2 weeks ago, we set an initial goal of doing 25,000 shots per day. Well, we have met that initial goal, and in fact, we are now exceeding it. Our average is over 26,000 shots a day. And that's good news. Here's where we are now. 64.2% of first doses have been administered. Now, let's talk about how we're going to accelerate it and move toward our next goal of 50,000 shots per day. We start with vaccinating people who are most vulnerable, starting with older people who live in long-term care. As you know, the federal government brought CVS and Walgreens in to vaccinate people who live in long-term care facilities. They've been doing a good job, and they've been doing what the federal government asked them to do. But I spoke to their leadership last week and asked, what's your timeline to vaccinate everyone living in these facilities? The answer was later in February, as the federal government wanted. I said, we need you to please do it faster. They agreed, and I'm grateful for what they have done. Their fast action means more shots in more arms in Virginia, and this is good news. We're grateful to have these companies here with us today. I'd like to introduce Dr. James Satterfield from Walgreens. He is their Regional Healthcare Director, responsible for Virginia and states from Delaware to Pennsylvania. And then we will hear from CVS. We're joined by Dick DeCassian, who is also a Divisional Vice President for CVS. So Dr. Satterfield and then Dick DeCassian, welcome. Thank you.
Thank you, Governor Northam. James Satterfield with Walgreens. Do want to give you an update of where we are as a company when it comes to the long-term care facilities, specifically the skilled nursing facilities and the other long-term care facilities. So, as you all may know, we started the COVID-19 vaccine portion with the Centers of Disease Control and Pharmacy Partnership for Long-Term Care on December 28th. Since that time, we've completed 92 skilled nursing facilities and are in the process of pulling forward and completing our assisted living facilities as well. Those assisted living facilities beyond the skilled nursing facilities, 94% of those will be completed by the end of the month, with the remainder being completed by the first week in February. Currently, we've given over 18,500 shots to the most vulnerable in those long-term care facilities, and look forward to completing those doses in the required timeline. So do want to thank the governor and his staff and others for helping us collaborate through this process and continue to support those who are most vulnerable in our communities. Thank you.
Thank you, sir. Appreciate it. Well.
Good afternoon. I'm Dick DeKessian, Division Vice President for the Mid-Atlantic for CVS Pharmacy. First of all, I want to thank you, and thank you, Governor, for supporting us and your true partnership in this endeavor. We've got a dedicated team of healthcare professionals, pharmacists, nurse practitioners, and technicians that are helping us with this endeavor, and excited to be a part of this solution for Virginia to ensure that we're helping to get more shots into more arms. With that being said, just to review, as far as the contact was concerned, there were two, as far as the two facilities that we were going to go into. Number one was the skilled nursing facilities, and then also secondarily would be the assisted living facilities and other facilities. So with that, as far as where we're at today for CVS, our first round of COVID vaccination doses, we've gone to 195 skilled nursing facilities that we were dedicated to vaccinating and have completed those. And right now we're about halfway through those as well, and plan to complete those on the second doses by February 8th. Today, we've had 43,000 doses administered within skilled nursing facilities. Also, we started administering to the assisted living facilities, which Virginia activated on January 11th, and within 3 weeks, we'll have all 611 facilities completed, except for about 3% of those, which was delayed only because the facilities asked to do it at a later date, which will be the following week after that third week. And today we've administered 20,000 doses within assisted living facilities. So we are on target with our goals within completing these within 3 weeks, and then also completing the second doses within 3 weeks thereafter. So in addition to that, we're in conversations with the Commonwealth as far as how we can partner and use our retail resources to help them do the general population as well. And I know that we had a conversation with the governor just last week to figure out ways in which we can help support them and make sure that we can get more shots into arms. So we're grateful for that as well. So it's been a Herculean effort. We're certainly humbled by that. My teams are humbled in going into these facilities, and we got family members looking in the windows and supporting us, cheering, and really crying when this happens. And we know and we understand the purpose of this, and we are truly dedicated to help support this in any way we can. So thank you.
Sir, thank you. Appreciate it. These pharmacies are doing very important work, reaching people who are at most risk. The faster they get done, the faster more shots can get to the next groups across Virginia. We'll talk more about next steps with our pharmacies in upcoming briefings, but for today, I want you to know how much Virginia appreciates your work, so thank you. So that's what we're doing with pharmacies to get more shots in more arms faster. Now, let's turn to our hospitals. Here's where we are. Healthcare workers were also included in the first round of eligibility. Many of them work in hospitals So lots of doses went to hospitals to cover them for both first and second doses. Hospitals have been working hard to vaccinate their employees. They should be done with their first doses. So my message to hospitals is this: there's no excuse for first doses to be sitting there unused. Get them out and get them into arms now. We're also working with hospitals and local health districts to make sure they're not holding on to too much supply of second doses, especially if they won't need it for several weeks. So my team and I have been working the phones, asking hospital companies to shift excess supply to others who can get more first shots in arms right now this week. And hospitals have really stepped up, and I appreciate that. By shifting inventory around, we're going to be able to increase the number of shots this week by about 20%. That's about 40,000 more shots by this Sunday, on top of the 175,000 that were already planned, and that is good news. One of the leaders in this effort, and he has been here before with us, is Dr. Mike McDermott, CEO of Mary Washington Hospital in Fredericksburg. He has really stepped up, as have a lot of CEOs from other hospitals, and I'd like you all to hear from him today. So, Mike, thank you and welcome.
Thank you, Governor Northam. Good afternoon. I'm Dr. Mike McDermott. I'm the President and Chief Executive Officer of Mary Washington Healthcare in the Fredericksburg area. I'm also the immediate past chairman of the Virginia Hospital and Healthcare Association. I want to thank Governor Northam for the opportunity to be here today and for the administration's ongoing collaboration with hospitals and healthcare providers across the Commonwealth as we continue to battle COVID-19, the pandemic, and we also work to vaccinate Virginians as quickly and safely as possible. Overall, Virginia hospitals have administered more than 318,000 vaccine doses since mid-December, and we are proud to help lead the way in this critically important, life-saving work. To give you an example of how fast vaccination capacity is scaling within our hospitals, Virginia hospitals have increased vaccinations by 35% in the past week. The population of people vaccinated so far includes hospital staff, other healthcare professionals, and more recently, essential workers and vulnerable Virginians who are now eligible to receive vaccinations. As I look back at the last month, a few observations come to my mind. First, I was surprised that the federal Operation Warp Speed in the previous administration did not include plans for the last 12 inches of the vaccine effort, getting doses into arms, arguably the hardest logistical task in the process. Second, the lack of transparency from the previous federal administration preventing appropriate preparation for that formidable task. Nevertheless, our Commonwealth got to work, and we got to work at Mary Washington Healthcare. We immediately began our vaccination program with a paper-based system. We used that in our field hospital that we had converted early in the pandemic. Fast forward just a month, and we have since expanded to a fully digitized operation in our nearby Fick Conference Center on our hospital campus. And if I may, I'd like to just take a moment to tell you a little bit about that clinic. When our clinic is running at full capacity, we are currently able to vaccinate more than 2,000 scheduled people per day. When cars arrive, they are greeted, arrival is noted in our system, and they park to wait for a text message to be told to come inside to receive their vaccine dose. We do that to manage the number of people in the building at any time. Our scheduling system and on-site logistics work to efficiently move people through the process from registration and check-in, vaccine administration, to observation and second dose scheduling, and then departure. Many have marveled at this process, gushing that our operation is smoother than a Chick-fil-A drive-through. It's difficult to think of a greater compliment. Inside the clinic, the positive energy is palpable. It's an environment full of excitement and gratitude from patients and the clinic staff's satisfaction about being of service to our community. As a physician, I have done vaccination shifts myself at the clinic, and I can tell you that afterwards, you emerge filled with hope. As we look back, it's been a difficult year, and we've all been forced to sacrifice in many ways to help combat this global pandemic. But we've been resilient, we've adapted, and we've endured. I saw a great cartoon the other day where a child is looking up at her mother's upper arm, a round mark on the upper arm, and the child inquires, "What is that?" And the mom responds, "It's my smallpox vaccine scar." And the child asks, "How come I don't have one?" And the mother's response is, "Because it worked." Now we're fortunate to be receiving and distributing new doses of hope to our community, paving the path out of this pandemic to a brighter future. To give you some perspective on our progress, we've administered more than 16,000 vaccine doses so far at Mary Washington, over half of those in the last week alone. This week, we expect to administer another 8,000 vaccine first doses. We currently have the capacity to do more than 2,000 doses a day, and our team has plans to implement even more capacity. We have a very strong partnership with our local health department and a shared purpose of working to vaccinate our Rappahannock region. I've shared with you our experience at Mary Washington Healthcare, but many Virginia hospitals have built similar clinics in a very short time, creating a tremendous amount of scale to be ready to administer more vaccine doses to our fellow Virginians. Across Virginia, hospitals are currently capable of administering more than 100,000 doses each week if there is adequate supply. Many other hospitals across the state have also set up clinic sites in partnership with local health departments and community organizations. In this past month, we have come so far. The metrics improve daily as systems get interfaced and caught up from our initial paper-based processes to be formally accounted for in the digital systems to reflect our true efforts to date. This administration is actively sourcing and redistributing vaccine to ensure timely administration of all available vaccine doses to citizens of the Commonwealth. Only a month into our efforts, we now share a common challenge, a limited inventory of vaccine doses based on what the federal government is able to send to the state. Under these challenging conditions, we're appreciative of proactive steps taken by the Northam administration to move even faster and get doses into the hands of people and organizations who can use them. As hospitals, we stand ready to support the Commonwealth in rising to the occasion by ensuring we have the capacity to administer these COVID vaccine doses to our fellow citizens. We have built an engine to help power this effort. We just need fuel in the form of COVID vaccine doses from our federal government to propel us forward to our brighter future. Thank you very much.
Thank you so much. Really appreciate it. Well, thank you so much to Dr. McDermott. And I just wanted to say a word that, when this pandemic started in Virginia back in March, the hospital, the healthcare systems have really had to step up, first starting with access to PPE, and then testing supplies, and then being able to get out and test individuals across Virginia, and they continue to do that, by the way. They have been there every step of the way, taking care of our sickest patients on a day-to-day basis. Their staffs are literally tired, but have never complained, and now they're part of the vaccination program and process. So on behalf of Virginia, we are blessed to have so many great hospital systems in Virginia, and I thank all of them for all that you've done. And we're in this together, and we're going to get where we need to be. Now, before we turn to the next steps on transparency, I want everyone to be clear about who is eligible for shots and how that works. Virginia is now allocating shots to communities based on population. The federal government allocated doses to states that way, and that makes sense. At the beginning, only healthcare workers were eligible, so we sent the shots where those workers are. Now, regular Virginians are eligible, so the shots need to go directly to them. Like every state, we expanded eligibility much more quickly than we expected. That's led to confusion about how to prioritize. So today, the Virginia Department of Health is issuing clear guidance to local health districts. Here is how to allocate your supply. Half of available doses should go for people age 65 and older. The other half should be used for frontline essential workers and people who are at increased risk of severe illness, as the CDC identifies. You've seen this list of frontline essential workers before. It's first responders, teachers, and others that we have discussed before. These groups are about the same size, but they are very large. It will take several weeks to reach everyone, and I ask you to keep that in mind. I also ask you to remember, if you jump the line, you're taking the spot of someone who needs it more because of their health condition or the job that they do in Virginia. We'll all have to trust each other, and I'm asking everybody to do the right thing. Now, I want to turn to transparency. I know that that's on everyone's mind as well. We talked a lot about this with the governors yesterday, too. States around the country are reporting data in different ways, and that's not surprising. The CDC said they would on this. Here in Virginia, we are making changes. Right now, during this briefing, we are launching a new vaccine dashboard, and here's what it will look like. It includes more information and more clarity. And I know some of that print is hard to read. It's a busy slide. You can see how many doses have come into Virginia, where they have been delivered, and where they are sitting. You can see how many people have received their first shot, how many people have received their second, and how much of Virginia's population has been vaccinated. And that's good news. I want to talk specifically about data around race and ethnicity. It's really important to make sure that equity is built into the vaccination program and that you can see what's going on. So I directed the team to do more and to move faster. We are doing 3 things. First, on Monday, Health Commissioner Dr. Norm Oliver wrote to every clinician in Virginia and told them, collect this information, it matters for transparency. Second, we updated all of the relevant websites and customer-facing applications with these words. Please list your race, ethnicity during vaccine registration and at the time the vaccine is given. We ask because we want to ensure that our process for data collection and vaccine distribution is fair, equitable, and transparent to all Virginians. And third, I'm backing legislation from Delegate Lamont Bagby and Siobhan Donovan moving through the General Assembly that will make it a requirement to collect this information. It's the right thing to do, and it's a critical tool to provide you the transparency that you expect. Now, I've heard from a lot of people asking me the same questions. Where can I get a shot, and how do I sign up? How do I sign up my elderly parents? These are questions we expected to address in February, but like every state, we expanded eligibility much more quickly than we originally planned. That has led to confusion about where to sign up and when. That confusion is justified because the answer has not been clear, but we're going to have this fixed very soon. Right now, the solution is to go to your local health district's website or to call them. They've all been directed to create a vaccine registration system so they can take your information and organize appointments. But that's fragmented. It's fine if you can get through, but not nearly enough if you can't. So I've directed the Virginia Department of Health to stand up a single statewide system with a phone number and a website where every Virginian can go and have their information go to the right place. That is not ready today, but I expect it to be ready soon. And I've told the health department that this is a priority. I know this has been a source of great frustration for a lot of Virginians. I hear you, and we're getting this fixed. In addition, we expect to dramatically increase the size of our call center, adding more people to answer the phones. This isn't in place yet, but it also will be soon. I take this seriously because I know that people just want answers. Even if the answer is that they can't get an appointment for a month or two, it's important that everyone knows how to find out where to go and how to sign up. Finally, I want to update you on a couple of other issues. As you know, we have a whole series of safety policies in place to protect people during the pandemic. Restaurant capacity is limited, bars are closed, social gatherings are limited, and more. We all know what they are. No one wants these rules around forever, so they are set to expire this week. But we need to keep them in place a while longer. So I will issue an executive order today extending the current policies through the end of February. We are ramping up vaccinations. This is no time to let down our guard. I also want you to know that the Department of Labor has made our temporary COVID workplace safety standards permanent. This includes standards around PPE, sanitation, record keeping, and plans and training around infectious disease preparedness in workplaces. These standards become permanent today. In closing, I want to say what is on everyone's mind. Vaccines are the light at the end of this long and dark tunnel, and they are a great reason for hope and optimism. I also want to acknowledge that everyone is out of patience, and I understand that. That's why I wanted to make sure that you understand the actions that we're taking to get more shots in more arms every day. It will take time to reach everyone, but we are reaching more people every day, and the pace is increasing. So I ask you to please do the right thing. Let the most vulnerable people get their shots first. Keep washing your hands, keep wearing your mask, and keep distancing from other people. It's the right thing to do to take care of each other. I also want to say a word to our team here at the state capitol and everyone working throughout Virginia in healthcare. You are doing heroic work. I want to thank you for stepping up in a big way. I know that you're exhausted and you're out of juice right when we're asking you to push even harder. I also know what you're capable of, and I have seen you rise to meet the job that needs to be done. We need you to do it once more, and I have faith in you, so thank you. With that, I'll be glad to take questions. Henry, I'll be glad to start with you.
I ask Governor two things. One, do you think the criticism of the rollout, both you and of those doing it, is fair? And then also just
Let me just answer that first, Henry, if that's all right, and then I'll come right back to you. I want everybody to know, the question was, is the criticism fair? And as I said, Henry, early in my remarks, I feel the frustration out there. I also, as a medical provider, feel the urgency. We are doing everything that we can to save lives. And at the end of the day, as the governor of Virginia, I'm responsible. So the criticism is fair. I also think the criticism is helpful. We hear from a lot of different people, as I'm sure you do, throughout our Commonwealth, people that have suggestions. And I've always said that we don't have a monopoly on ideas, so I've always tried to be receptive to others' ideas, to their criticism. And again, as long as people are criticizing in a way to be part of the solution, that's a good thing. And so we deal with that, whether it be constituents across Virginia, whether it be our local leaders and our cities and towns, and we're doing everything that we can to communicate with them, all being on the same sheet of music. But people are frustrated. That's a given. I get it. And I just want people to know we're working with folks across Virginia, doing everything that we can to get shots in arms as fast as we can. And everybody, wants to get this pandemic in the rearview mirror. So I get that. So what's your next question?
These are helpful. I would hope maybe you guys during these times would hold these maybe at least weekly.
Yes, we were thinking every day, Henry, but I might be the only one standing up here. So no, we would. I think it's to your point, and I appreciate that. It is so important to provide people across Virginia and across this country accurate and updated information. And as you all know, it's a very dynamic situation. It changes every day, and so I'm committed to doing that once a week, and if needed more often, we will. So thank you.
Sarah Rankin, Associated Press.
Yes, thank you. Hi, Governor. I'd like to ask about this six-figure gap that persisted between the doses we've received and the doses that have been administered. I just wanted to ask again, does your administration know where all those doses are, and are you still confident that none have gone to waste?
Yeah, thank you for that question. And I think we talk a lot about the numerator and the denominator and the delta between doses that we received in Virginia and doses in arms. And I could give this a shot, literally, but I'm going to let Dr. Avula, who's doing an amazing job as well, take that question. Danny, thank you.
Thank you, Governor. So part of what rolled out today in this new dashboard is providing significant clarity to where the gap is. We break down, by first and second dose, so that gives a lot of clarity. We break down by aggregate provider type, and so you know where the doses have gone. So I think in the big picture, we absolutely know where the doses are, and I will describe as we've done a few different times. We look at about a 400 to 500,000 dose gap. The largest chunk of those are second doses that have been delivered to Virginia and are ready to be administered, but are waiting for those appointments, right? So let me kind of just break it down a little bit. Let's say you're a health system that received 10,000 doses of vaccine on December 21st. You got through much of your staff in that first week. The next week, you got through some more of your staff, and because of the holidays, some people deferred to the following week. Now, you get the delivery of your second doses 3 or 4 weeks after December 21st. And so all of those second doses are allocated, they're reserved for somebody who should be getting a second dose, but they can't actually be given until 3 or 4 weeks after the shot was administered. And that's what we're dealing with right now when we have somewhere around 260,000 second doses that are ready for administration, but we've got to wait for individuals to reach the appropriate dosing interval. And so we've broken down where some of the data gaps that we've talked about in the past have really been worked through, and we're narrowing that gap as every single day. What you'll see over the last 3 days, in addition to the somewhere between 20 and 25,000 shots that have actually been administered, you've also seen an additional 20,000 data points that have been added from past shots that have been administered. And so we're closing that gap and catching up, but that explains where most of the vaccine is, and that gap will continue to close as we continue to manage our own inventory.
Thank you, Dan.
Yeah, you mentioned that you're directing the state to set up a centralized sign-up system. You also said you're aware this has been a big source of confusion and frustration for many people. So why is this centralized system just being set up now when we knew that this was coming for months?
Well, as I said earlier, Jackie, the system, the design that we had in place, we had not intended to expand how many people were getting doses until February. So this isn't something that we're just starting to work on today. We've been working on it, and we're very close to having it. But to date, what we've been doing is people have been registering and calling through the local health departments, and we realize that needs to be improved. And so the system that we're working on will be a central system where people can register, where they can get more information, and then where we have that data so that we can follow. So it's been in the works. It's just we hadn't intended it to be ready at this time, but we're really rushing that as quickly as we can, and it will be up and running very soon.
Sarah Robinson, CBS 19. Are you on the line, Sarah? go to Luann Wright for Roanoke Times.
Hi, Governor. I appreciate Dr. McDermott's description of the clinics, and we're seeing a lot of those here, getting through like 2,000 people a day. They're relying a lot on volunteer nurses, especially to deliver the shots. And I'm wondering, how sustainable is that? I mean, I know we're in the phase where doses are scarce, but once they become abundant and you step up these mass clinics, what is the plan for staffing these?
Yeah, it's a great question. I'm going to let Dr. Carey come up, but one of the points I would make that we haven't given credit to today, I have at other press conferences, and that is our National Guard. They have been very helpful in working with testing. They're continuing to test throughout Virginia, but we're going to bring them on. About 200 individuals that are trained and prepared to give vaccinations, in addition to our volunteers, in addition to those that are already staffed in our clinic. So it's an all hands on deck right now, and as you know, our National Guardsmen have been up in Washington dealing with the insurrection there. There are over 1,000 remaining there that will be there for another few weeks. We look forward to having all of our National Guardsmen back in Virginia so that they can focus on some of these jobs at hand. So, Dan, anything in addition you'd like to add?
Thank you, Governor. What I will add only is that the Unified Command, that's VDH, the Virginia Department of Emergency Management, as well as the Guard, are looking at the 40 community sites around the Commonwealth. And we're looking at how we can support them better. Some of them are sustainable, and we just minimal support and a lot more vaccine takes a 3,000 per day site to a 7,000 per day site if we had the supply of the vaccines. Others, they do have staff that are either volunteers that need support, or they are nursing staff from health systems that really need to get back into the acute care setting. In those settings, whether it's contractors or whether it's additional volunteers and support and guardsmen, we're figuring out on a site-by-site basis what is the best way to support those as we move forward, especially to be ready when supplies of vaccine are ready to take those to a much higher sustainable level. So that's occurring with work with the localities and the state resources to work through exactly what those plans for sustainability and growth are, region by region and locality by locality. Again, there's a lot of locality and local government folks that are also part of that, and how sustainable is that. So we're figuring that out. It's very variable by region, and we're working through those details to make that sustainable and expandable.
Do you mind just commenting on the piece of legislation in our executive order to allow more people to give vaccinations as we move forward?
Sure thing, Governor. The Governor mentioned that the other aspect is the vaccinators. How can we make sure that we have the supply beyond those who are currently licensed and traditionally vaccinate, like our registered nurses? So we share the same goal, the Governor and the General Assembly, to make the number and supply of vaccinators much more broad. And we can see in the bills that the number of people within the Department of Health Professions will be greatly expanded, that under the state of emergency, will be able to vaccinate with training. Some will need longer training who have not been vaccinators in the past, and physicians and veterinarians and podiatrists, for example, who do medical procedures all the time, but will be in a position to vaccinate. Again, always under a registered nurse to make sure the doses are right and that there's safety.
I was wondering if you could discuss sort of the oversight and coordination with our hospital systems. Because on the one hand, we know that some hospital systems have vaccinated non-frontline employees with their first doses of vaccine. But on the other hand, we're also hearing that health systems are getting their doses significantly cut, even as they've built up the capacity and have been administering vaccines in the community. So why are we seeing such a disconnect, and what are we doing to address it?
All right, thank you. Dr. Carey.
The question really is how we are coordinating with our health systems, because we've seen some variability across the Commonwealth. And I think that the main way we're dealing with that is making sure we're communicating and working together. And I think we see this with Dr. McDermott, and just yesterday, Dr. Avula and myself, we were on the phone multiple times per day with multiple health system leaders, in addition to the health departments and other community stakeholders. So I think that coordination is key. And one thing I've observed is that the places that are doing this really well and that we're sending folks from the state to observe as to become part of best practices with these large-scale community sites is where the health systems, the localities, and the health districts are working very, very closely together. When that is happening, all across the state, that is happening, but the folks that are doing it particularly well is when that connection is really close. So when the governor talks to local leaders, when the governor talks to health systems and local health districts, it's about that collaboration and that teamwork. And we're seeing it all over the state, and it will only grow. So we're really excited about that.
How will they fit into plans for stand-up mass vaccination clinics?
Yeah, I think they will very much be a part of that. I think it depends. In some localities, the health systems are prepared to provide leadership and provide sites, and their staff may drift back to their previous roles because they've been filled in by state personnel like National Guardsmen. And it will be on a region-by-region basis. Again, we're going to look to see who can provide the most and how it's sustainable, knowing that the health system's mission continues, whether it's in acute care or all the other types of care they provide. So I think it will be a little bit different depending on the needs of the region, although the principles are the same. Teamwork, teamwork, teamwork.
Do we have Jean Judon with WDBJ? Are you on? Okay. David McGee with the Bristol Herald-Courier.
Yes, thank you, Governor. I wanted to ask, we're hearing a good bit of concern here in far southwest Virginia about the supply, and you talked about that earlier in your remarks, but given the high positivity and the record number of cases we've seen here over the last few weeks, how can you reassure folks in this part of the state that they're going to get their share of the vaccine as well?
Yes, well, thank you. And the question was about the Southwest, and it's not just the Southwest, but the Eastern Shore where I come from, or really any area in Virginia. People literally are saying, why aren't we getting more doses? And the shipment comes into Virginia, and then we dispense it throughout Virginia through population-based data. And so that's the way the system will continue to move. I would, and just to follow up on some of your questions, Kate, which I appreciate, I speak with my fellow governors frequently, and a lot of the challenges that we have in Virginia are not unique to Virginia. And a lot of I think the challenge moving forward is really going to be supply dependent. And I'm confident that our system that Dr. Carey was just talking about, the sites that we'll have set up, we're even going to have mobile sites in Virginia. The DMV has volunteered some of their units to go into some of the underserved communities. But the biggest challenge that we have, and the one that's most frustrating and that I as a medical provider see as a real urgency, is the supply. And we're getting about 105,000 doses a week. If we're going to get to 50,000 shots a day, if you do the math, that's 350,000 doses per week. So we have a large delta there. That's frustrating for me. It's also frustrating for other governors. And we're doing everything that we can to work with our leaders in Washington who are working with the pharmaceutical companies to really ramp up the production, not only of the doses, but also of the equipment, the needles and the syringes, the things that we need to be able to give those. So we're going to ramp that up and encourage them to ramp up as quickly as we can. But moving forward, our progress is going to be very much supply dependent. Andre, I know you've had a question.
I do have a couple, if I may.
Hold on now, Andre, one at a time.
First, could you speak to those health agencies who are concerned because they don't get the money that the General Assembly approved because some of the smaller ones don't accept Medicaid. So they feel like they're kind of out of the loop, but they still have people who are working just as hard as those agencies that do accept Medicaid.
Hold on, Dan, do you have any thoughts on that?
I'd be glad to.
Yeah.
The question really was around home health providers that are enrolled in the Medicaid system versus those that aren't. And the main mechanism we had to distribute that support through CARES Act dollars was through the Medicaid program. So that was the mechanism to get the most providers involved, but we understand that there may be some gaps there.
For those agencies, or is that a major?
Yeah, Andre, we have PPP loans. We have the Rebuild Virginia that we're using for grants for small businesses. So I think there are other options out there, but just not through the mechanism that we had through the CARES relief.
As we talked before about crime in the Commonwealth, I interviewed your Secretary of Public Safety, and he talked about that crime was up because of COVID. With all this potential money coming down from the federal government, is there any way that some of these funds could be maybe diverted or sent to law enforcement agencies to get maybe more police officers, more investigators? Again, Governor, crime is up in the Commonwealth.
It's a good question, Andre, and you know, there are certain things that we have been able to do in the past, allocating the funding that is coming from the relief funds. The way it's set up now is that money that's coming from Washington is already directed toward different agencies, and so I don't have any control over that. The other mechanism, though, is we have our legislature here in town, and they are working with our budget now, and as you know, the legislature appropriates money, and so I'm sure that they're taking that seriously as well, and if there's revenue or resources that can go toward that, they will make that a priority.
Harry Pugh, Inside Nova.
Hello, Governor. Several school districts in Northern Virginia are waiting to discuss in-person return to learn based on when teachers might receive vaccines, and that's been hit or miss, as you know, in Northern Virginia. Do you have any idea when teachers may, or is it just the same as anyone else? I mean, if they are in the 1B phase, do you have any idea when teachers may be ready to go back to school, and what would you say to school boards who are using that as a decision-making tool?
Yeah, I'll try to make my response fairly brief, but that could be a long-winded answer. The question is about when our teachers will be vaccinated, and we've had a number of clinics. I've been to one in Roanoke. This weekend I'll be at one up in Prince William County. We, as you know, have made vaccinating our teachers a priority. They are near the top of the list in 1B. So we have already vaccinated a number of teachers and will continue to do that, supply dependent as quickly as we can. The other part of that question, though, I think, is that, you know, while we want our teachers to all be vaccinated, while we want the staff to be vaccinated, that's not what opening our schools or getting our children back into the classroom is totally dependent on. We have looked at the data very carefully. Our schools are able to follow our mitigating measures, and schools are actually a fairly safe place for our children. That's become more clear every day. So I will continue to allow the localities, depending on what their numbers are in the communities, I'll allow them to make the decisions on if and when our children can get back into the classroom. But certainly our emphasis at the state level from our Secretary of Education, from our Superintendent of Public Instruction, is to know of this data, to continue those measures, to get teachers vaccinated as soon as we can, but really move toward getting our children back in the classroom as soon as we can.
Can someone talk about why it's taken so long to vaccinate our long-term care facility residents? Governor Northam, I know that some states have opted out of that federal partnership. Are you satisfied with the progress and the work that they've been doing? And this question, I guess, was for Dr. Oliver. I'm not sure who could answer it, but any updates about the new variant that has now arrived in Virginia? Has the state considered new guidance for residents as to how to keep themselves safe from that new variant?
Let me come back to the second question. The first question you asked is about, am I satisfied? I'm satisfied that we signed on as a Commonwealth to work with Walgreens and CVS. We've had a great relationship. We had discussions last week, as I said, that can you speed up the process, and they have assured us that they will. There have been a lot of challenges, Mel, and I could let them speak to those, but one of those challenges I'll just bring up, I think the public would appreciate this, is to go into a long-term care facility and say, we're here, we have the supply, we have the staff to administer the vaccination, and a number of them said, we're not quite ready. We especially staff, we are choosing not to receive the vaccination, and maybe we could get it when you come back for the second dose. Well, we're not comfortable with that approach either. So that's been a challenge. But overall, the answer to your question, I'm pleased with the work that they're doing. I can promise you, they're doing it as expeditiously as they can, and we'll continue to work together to get those individuals vaccinated, because as we know, they are our most vulnerable, or certainly at the top of the list of most vulnerable population. And can you repeat your second question, please?
My question was about the new variant
Yes.
was identified in Virginia this week.
Yes.
Is there new guidance that you guys are working on to help people prepare against that variant? Any updates for folks as to how they should be taking that news?
Dr. Avula was anticipating that question, Mel, and he's headed toward the podium. Danny?
The question was, with the identification of a new variant of COVID in our Commonwealth, does that change our guidance at all? And so, so one thing to say is that Dr. Tony and the folks at DCLS are regularly serotyping lab samples as they come through, so that we can identify when new variants have come into the state of Virginia. We follow it both carefully in Virginia, but also across the world, and so we know these variants have popped up in different places. Obviously, the one in the United Kingdom has probably been the best known and led to the largest spread of disease. There's also another variant in South Africa. What we know about these variants at this point is that they are not causing any more severe disease than the original strain of COVID, and that they appear to be protected by our vaccine. The biggest shift is that they are more contagious, that our not number is higher. And so what we've got to do to prevent is all of the things that we know work. Wear our masks, stay home when you're sick, social distance, wash your hands. We can also rely, at least what the data tells us right now, we can rely on the vaccine to continue protecting us from that variant. But we will continue to monitor it, and DCLS will continue to sample, and will provide new guidance when it's needed.
Wear 2 masks or maybe wear a different type of mask. Is that something the state is going to leave to the CDC to issue any guidance needed, or?
Yeah, the question is, some experts have said wear 2 masks or wear different kinds of masks, and the CDC has provided pretty consistent guidance on this along the way. From the beginning, they have said wear a double-layered mask. Don't wear masks that have one of the vents in them that allow you to breathe out and spread particles that way. So we're comfortable with the CDC guidance. We think it is pretty clear and explicit. I think we will continue to point people towards it and help people recognize that single-layer neck gaiter is an ideal, and masks with a funnel is an ideal, and that we really should wear double-layer masks. And some people have I've noticed in the last few weeks that people have started to wear 2 masks, and that feels appropriate as well. We certainly wouldn't discourage that.
Thank you, Dan. Well, I just wanted to reiterate what Dr. Avula just said, and I appreciate your question, Mel. And while we're dealing with the strain of COVID-19 that we've been testing for since March of this year, there are other strains, the UK strain, the one in South Africa, as Danny alluded to, one in Brazil. And the message is while we move forward with our vaccination process, this virus is still alive and well, and we all have to remain vigilant and do the things just like Dr. Avula stated. We have to continue to wear our masks. We have to continue to keep our distance. Gatherings, I just ask people, like in our colleges, in their private homes, we know that when people gather together, especially in closed places, that this spreads like wildfire. It is very, very contagious. So follow those guidelines. Keep yourself, keep your neighbors safe and healthy, and we'll get through this together. And Henry, at your request from Channel 12, we'll look forward to having another press conference in the near future. I suspect it'll be after this weekend, but thanks, and I look forward to that. Thanks to all of you for being here. Stay safe and healthy, and we'll see you soon. Thank you.